po, this is in contrast with IPC, wherein ang pinaka-thrust niya talaga when you go to the model is that there is constant communication with the healthcare professionals, and what was suggested is actually there should be communication before, during, and after your patient interaction. And yun rin po, in the interprofessional model, it's really patient-centered. So aside from communicating with the healthcare team, sometimes for some models, they also include the patient in the decision-making po.
Pilates caters to a vast range of clientele. So you could start with someone who has medical condition that would be they would be under rehab Pilates. Also have what's this? Regular Pilates for those who just wants to stay fit and active. And there are also advanced Pilates exercises for elite athletes.
But locally, we have limited studies on it. In my case report, I've cited several reasons, several factors, such as first, the lack of research on telerehabilitation, so lack of evidence.
Okay.
Second is the lack of acceptance and the readiness among stakeholders. So the stakeholders include the patients, the family or caregivers, the healthcare providers, both doctors and the therapists.
So the internal check. When I see my patient, I break your pelvic floor into layers. It's like oftentimes we refer it to like your pelvic muscles like an onion. So there's layers and layers and multiple layers that have different functions. So there's three functions in your pelvic floor. They call it the 3S: sexual, sphincteric, and supportive.
Is the company investing too much, or is there savings behind that? So the result of the study we conducted was the company actually saves a lot, because if you don't invest in those equipment, and if you don't follow the different ergonomic principles, syempre it will result to injuries, and injuries will incur a lot of money din, di ba? Like people will be hospitalized, whether in an outpatient or inpatient basis, if they incur injuries.
Physical therapists are being called in the emergency room to see their impairments and functional limitations if they are suspected of stroke.
Okay.
So I do the usual physical therapy examination in the emergency room. But they don't just refer the patients, they make sure that the patient is at least within their vital signs, they're stable.
Yoga is healing, and it's actually coming to terms with yourself of what you can and cannot do, and being okay with that.
Right.
And it's a matter of, yoga is also a process of self-discovery and self-mastery.
Practitioners in home health, especially physical therapists, for example, they have two options. Are they going to restore the patient's functional status, or are they going to maintain? So there's a restoration piece, there's a maintenance piece.
You have to remember 4 P's. So for first P is the promotion and maintenance of health of the worker. So when we say health, we does not deal with physical health. We also deal with mental health and social well-being of the workers. So our primary concern would always be the worker or the working population. So that's for the first P, promotion and maintenance of it.
Wound care is very unique, considering the fact that not a lot of us underwent the training in school about it. Although if you review the Practice Act, we are not limited to modalities in wound care, as we know. We actually do selective debridement, meaning like sharps debridement. It's part of our practice. Even if you were not certified, you are allowed to do selective sharp debridement as long as it is non-viable tissue.